Hello, everyone. My name is Ryan Gaskins, and today I'll be discussing the oral microbiome and periodontal disease, and more specifically, how oral health can impact overall systemic health. Now, when most people think about oral health, they usually think about like cavities, brushing their teeth, or maybe even just avoiding bad breath. And they usually don't think about things like heart disease, diabetes, or inflammation throughout the body. However, researchers are now discovering that the mouth is closely connected to the rest of the body through bacteria, inflammation, and the immune system. Now, this topic is especially important because periodontal disease is one of the most common chronic inflammatory diseases in the world, yet many people underestimate how serious it can become. And by understanding the oral microbiome and how periodontal disease develops, healthcare professionals can better understand how oral health may influence overall health. So, the main idea of my presentation is that the oral microbiome plays a critical role in periodontal disease, and its effects extend beyond the mouth, influencing systemic health. And over the past several years, scientists have discovered important links between oral bacteria and diseases affecting other parts of the body. This includes conditions such as cardiovascular disease, diabetes, respiratory infections, and even Alzheimer's disease. And these discoveries are changing the way both dental and medical professionals think about healthcare. And instead of viewing the mouth separately from the body, researchers now understand that oral health may contribute to overall health and disease processes throughout the body. And throughout this presentation, I'll explain what the oral microbiome is, how periodontal disease develops, how oral bacteria spread, and why these connections are important in healthcare. So, first, what exactly is the oral microbiome? Well, the oral microbiome refers to the community of microorganisms that naturally live in the oral cavity. This includes hundreds of species of bacteria, as well as fungi and viruses. And according to the National Institute of Dental and Craniofacial Research, oral biofilms can contain hundreds of microbial species interacting together in complex ways. And even though bacteria are often viewed negatively, many oral bacteria are actually beneficial. They help maintain balance within the mouth and can prevent harmful bacteria from overgrowing. This healthy balance is known as homeostasis. And the mouth provides an ideal environment for microorganisms because it contains warmth, moisture, nutrients, and multiple surfaces for bacteria to attach to. However, problems begin when the balance becomes disrupted, which is called dysbiosis. Now, dysbiosis allows harmful bacteria to dominate the oral environment, leading to inflammation and disease. Now, factors that can contribute to dysbiosis include poor oral hygiene, smoking, stress, poor diet, certain medications, and just systemic diseases such as diabetes. And this imbalance is one of the major factors involved in periodontal disease. Now, periodontal disease, also known as gum disease, is a chronic inflammatory disease that affects the tissues supporting the teeth. And it typically begins with plaque accumulation around the gum line. Now, plaque is a sticky bacterial biofilm made up of microorganisms and their byproducts. If plaque is not removed properly through brushing and flossing, it can harden into calculus, which creates an even better environment for harmful bacteria. And one important bacterium associated with periodontal disease is Porphyromonas gingivalis. And this bacterium is considered a major periodontal pathogen because it can interfere with the immune system and increase inflammation within the tissues. Now, according to the Centers for Disease and Control and Prevention, periodontal disease involves infection and inflammation of the tissues surrounding the teeth. And common symptoms include swollen gums, bleeding while brushing or flossing, bad breath, gum recession, loose teeth, and eventually tooth loss. And one reason periodontal disease is so dangerous is because it often progresses slowly and painlessly. Many patients may not realize they have severe disease until significant damage has already occurred. So how exactly does periodontal disease cause damage? Now, the process begins when bacterial biofilms attach to the teeth and gums. And as bacteria multiply, they release toxins and virulence factors that irritate surrounding tissues. The immune system responds by sending inflammatory cells to fight the infection. And at first, inflammation is meant to protect the body. However, when inflammation becomes chronic, it can start damaging healthy tissues as well. And over time, gum tissue begins breaking down, periodontal pockets form around the teeth, and bones supporting the teeth can slowly be destroyed. And one important thing to understand is that periodontal destruction is caused not only by bacteria themselves, but also by the body's own immune response. In other words, the immune system's attempt to fight the infection can unintentionally contribute to tissue destruction. Now, this is why periodontal disease is considered both an infectious disease and an inflammatory disease. And without treatment, this chronic inflammation can continue for years. Now, one of the most important discoveries involving periodontal disease is its connection to systemic health. Now, researchers now believe that oral bacteria and inflammatory molecules may enter the bloodstream through inflamed or bleeding gums. And according to the American Dental Association, oral bacteria can travel through the bloodstream and contribute to inflammation throughout the body. Now, one major condition linked to periodontal disease is cardiovascular disease. Now, scientists believe oral bacteria may contribute to plaque buildup inside arteries, increasing the risk of heart disease and stroke. Now, inflammation caused by periodontal disease may also place additional stress on the cardiovascular system. And another major connection is diabetes. Now, the relationship between diabetes and periodontal disease is considered bidirectional, meaning each condition can actually worsen the other. Now, inflammation from periodontal disease may increase insulin resistance, making blood sugar harder to control. At the same time, uncontrolled diabetes may weaken the immune system and increase the risk of periodontal disease. Now, researchers are also investigating links between periodontal disease and respiratory infections, pregnancy complications, rheumatoid arthritis, and Alzheimer's disease. And although research is still continuing, these findings suggest that oral health may have a much greater impact on the body than previously believed. So, how do bacteria from the mouth actually spread throughout the body? Well, actually, the answer is surprisingly simple. You see, when gums become inflamed, they bleed more easily, creating openings that allow bacteria to enter the bloodstream. And even everyday activities such as brushing your teeth, flossing, chewing food, or dental procedures can introduce oral bacteria into circulation when gum tissues are unhealthy. This process is called bacteremia, which means bacteria are present in the bloodstream. Now, normally, the immune system removes bacteria quickly. However, chronic periodontal disease may expose the body to repeated inflammation and bacterial exposure over long periods of time. This repeated exposure may contribute to systemic inflammation, which is associated with many chronic diseases. This idea is one reason why maintaining oral health may be important not only for protecting teeth and gums, but also for supporting overall health. Let's talk about the importance in healthcare. So, this topic is important because it changes the way healthcare professionals think about oral health. Now, traditionally, dentistry and medicine were often viewed as separate fields. However, research on the oral microbiome shows that oral health and systemic health are deeply connected. Now, dental professionals are not only helping patients prevent cavities and tooth loss, but they may also help reduce chronic inflammation and improve overall health outcomes. And according to the National Institute of Dental and Craniofacial Research, maintaining good oral health may contribute to better overall health. And this highlights the importance of regular dental cleanings, proper oral hygiene, early periodontal treatment, and patient education. And it also emphasizes the importance of communication between dental professionals and medical professionals when treating patients with chronic diseases. So for future directions. So the future of periodontal treatment may focus more on the microbiome itself instead of simply removing bacteria. Now, researchers are currently studying microbiome-based therapies, probiotics for oral health, and personalized dental care based on a patient's specific bacterial profile. And as scientists continue learning more about the relationship between oral bacteria and systemic disease, treatment approaches may become more preventative and individualized. Now, in conclusion, the oral microbiome plays a major role in periodontal disease, but its effects may extend far beyond the mouth. And when harmful bacteria disrupt the balance of the oral microbiome, chronic inflammation can damage oral tissues and may contribute to systemic diseases such as cardiovascular disease and diabetes. And as future healthcare professionals, understanding the connection between oral and systemic health can help us reduce better care and improve patient outcomes. Thank you.